We're going to talk about the Hamilton ventilator today during some of these videos, but the first thing we're going to do is we're going to talk about some buttonology that's on this ventilator and unique to this machine. On the front of the ventilator, you're going to notice there's an on and off button up top that you hold in, and what ends up happening, you'll see the turnstile knob light up green. This test screen will come up, which is totally normal. It runs through a self-test. There'll eventually be a bar graph down here that's indicating that it's running that test. Which is located right here, and it'll run a self-internal test, and that's basically checking all the electronics and stuff that's going on inside the ventilator. You'll hear the ventilator cycle one time, and that's just telling you that the machine is working properly. That's totally normal. As we move down these buttons, when you come over to here, there's a night and a day screen. You can change this from night to day. We also do have a night vision goggle option on this ventilator as well. If you're working with somebody and you want them to mess with your ventilator, you can actually lock the screen and unlock the screen with this button to the right. If you want to do an inspiratory hold on your patient, I really can't think of a reason why we would do that. You can hold this button and it'll provide you a inspiratory hold until you release that button. Over here, the oxygenation button, if you're getting ready to suction your patient and you wanted to do 2 minutes of 100% oxygenation, you wanted to pre-oxygenate your patient, you push that button and it'll provide you 2 minutes of 100% oxygen. And this button down here is for the nebulizer function, and I'll show you in a minute. But what's neat is when you engage the nebulizer function here, there's a side port over here that you connect your nebulizer to, and the machine will only deliver the nebulizer during inhalation, which allows the patient to only get the nebulization during inhalation, and provides them, they get all the medicine, which is pretty cool. You have an alarm silence button here that will silence your vent for 2 minutes. And the way that this ventilator works is it's a push, turn to whatever you want, and confirm. So it's push, turn, and confirm ventilator. This is your knob, and up here your control knob, and then down here is your 4.5 battery hour life. You have 2 batteries, 4.5 hours gives you about 9 hours of battery life. That's internal battery. However, we do recommend that if if you have the ability to plug the ventilator in, make sure you're plugging the ventilator in at all times. As you move around to the side, you do have your side panel. I've already discussed the nebulization port. This is where your nebulizer will connect. You have 2 other prongs here. These are your sense lines that will attach to your ventilator circuit. You have a blue and a white drive line here, and the circuit is actually color coded so that the blue will go to blue and the white will go to white. I'll show you that in a later video. This is your inhalation port for your ventilator, and this is your exhalation port. What's unique about this ventilator and the exhalation port is the ventilator, this will actually pop out. And these are disposable. However, they can be reused, and I would encourage you not to just throw these out if you don't have to. Why you would have to get rid of these is if the diaphragm was damaged. What this diaphragm does is it seats over this valve and basically that's what's going to maintain your PEEP. That's what's going to maintain your pressures on your ventilator. What that does is it locks in here like so, and it goes in one way. You're going to turn it to the right, you're going to feel it snap in place, and it'll go nice and tight. If you move around to the opposite side of the ventilator, you have your air filter. This is just for entrainment air. This is where the ventilator gets its cooling air from. You have your high pressure 50 psi hosing. You have your power cord, which connects here, and again we recommend you do keep that plugged in. And then down here you have a port that we can run this ventilator off a low flow oxygen, but we chose not to do that as an option. We prefer you to use the high pressure tubing in all circumstances. I think that's all.